everyone. Today we are going to learn about the brachial plexus. Now what is plexus? Plexus is the network of nerves or vessels present in the body. This nerve plexus present in upper limb is known as the brachial plexus. Brachial plexus is formed from the ventral primary rami of C5 to C8 and T1. That means lower 4 cervical spinal nerves and first thoracic nerve. Now components of the brachial plexus. It includes roots, trunks, division, cords and branches. Mnemonics to learn this is RTDCB. R for roots, T for trunk, D for division, C for cords and B for branches. Now on the basis of relations of brachial plexus with clavicle, it is divided into 3 parts: supraclavicular, retroclavicular, infraclavicular. Supraclavicular means part which is above the clavicle. It includes the first 2 components, that are roots and trunk. Infraclavicular means the part which is below the clavicle. It includes the cords and branches, last 2 components. And retroclavicular means part which is behind the clavicle. It includes the 3rd component, that is division. Now roots. Roots are formed from the ventral primary rami of C5 to C8 and T1 nerves. Means this C5 to T1 spinal nerves, all this consist of the roots. Now trunk. Roots of brachial plexus joins to form the trunk. It has 3 trunks, upper, middle and lower. The C5 and C6 spinal nerves joins to form the upper trunk. C7 root of the spinal nerve continues as the middle trunk, and C8 and T1 spinal nerves joins to form the lower trunk. Now division. Now each trunk, it is divided into anterior and posterior divisions. This upper, middle and lower, all 3 trunks are divided into anterior and posterior divisions. Now cords. These divisions joins to form the cords. There are 3 cords: lateral, medial and posterior. Now the anterior division of upper and middle trunk joins to form the lateral cord, and the anterior division of lower trunk joins to form the medial cord. Now the posterior divisions of all the 3 trunks, that are upper, middle and lower trunk, joins to form the posterior cord. Now branches. Branches of root, it includes nerve to the serratus anterior, also known as long thoracic nerve, root value C5, C6, C7. Nerve to the rhomboid, also known as dorsoscapular nerve, root value is C5. Now branches of trunks. Now from trunk, only upper trunk gives us the branches. First is suprascapular nerve and second is nerve to the subclavius. Now as the root value of upper trunk is C5 to C6, the root value of both this nerve is C5 to C6. Now branches of the cords. Lateral cord, it gives us 3 branches: lateral pectoral nerve, musculocutaneous nerve and lateral root of the median nerve. Median cord gives us 5 branches: median pectoral nerve, median cutaneous nerve of arm, median cutaneous nerve of forearm, median root of median nerve and ulnar nerve. Now the lateral root of median nerve and median root of median nerve joins to form the median nerve. Now posterior cord. It gives 5 branches: upper subscapular nerve, lower subscapular, nerve to the latissimus dorsi, axillary nerve and the radial nerve. Now all these root values are very important and you have to learn this. Now blood supply of the brachial plexus. Brachial plexus is supplied by a vertebral artery, thyrocervical trunk, suprascapular artery and a transverse cervical artery. Thank you.